So Kegels are actually the least effective way to train the pelvic floor. Well, okay, not doing anything for the pelvic floor is probably the least effective way to train the pelvic floor, but second to that, Kegels are the least effective way to train the pelvic floor. However, they can be an important part of starting to train the pelvic floor. So the way I like to explain it is what a Kegel is it is an isolated contraction of the pelvic floor muscles if your patient is doing it correctly, which our studies say only about 30% of people are, even if they've had instruction. So that's a whole other thing of its own. But a Kegel is really analogous to doing a quad set to turn the quads back on after knee surgery, or doing like some scapular retractions to start those subscapular muscles working.
Mm-hmm.
We do those things with our patients. But I hope that nobody who's listening to this podcast would ever consider making quad sets or those shoulder blade retractions their entire exercise protocol for anybody. Those are a start point to help people understand what it feels like when those muscles activate and to start to turn on muscles that people have gotten out of the habit of using or that have turned off due to surgery or inflammation or whatever. But as soon as we can, as soon as we're like, okay, yep, you know how to turn those on. Now I'm adding weight or I'm changing your movement or I'm doing other exercises that utilize those muscles but that don't isolate them. Because we understand that the scapular stabilizers and the quads don't function in isolation. Like there's literally nothing we do in real life that requires us to just isolate and contract the quads. That's not a functional movement. So as soon as we can, we're like, okay, now we're going to do some straight leg raises. Now we're going to do some short arc quads, or we're going to do some squats, or whatever the case may be. Same thing with the pelvic floor. In the real world, it does not isolate and isometrically contract. It is always working with the rest of the core muscles, with the hip and pelvic girdle muscles, and of course with the diaphragm, as we have mentioned before. And so are there times when I'll have people focus on isolating their pelvic floor with breathing? Yes, but that is a very short section of my work with them. And the purpose is really just to get it to where they can feel, am I lifting or am I lowering my pelvic floor? Once they get that feel, then again, I'm using the same exercises the rest of you are. I'm prescribing things like squats, lunges, bridges, jumping jacks, squat jacks, whatever the case. Like you can get really creative with it, because once they can feel it, literally any and all exercises can be turned into an exercise that is strengthening the pelvic floor based upon your cueing and your focus on how they're doing it.